Karnataka has crossed 1 lakh COVID positive cases. The numbers in Bengaluru also spiking, and the city has to be prepared. We're at a COVID care center on the outskirts of Bengaluru, which has the facility to actually look after 10,000 patients if need be. These are asymptomatic patients who will be lodged here. Joining us, Mr. Sarfaraz Khan. He is Joint Commissioner of the BBMP. What kind of patients will be coming here to this particular center?
This will have basically asymptomatic COVID positive patients who do not have any symptoms here, and they don't need any special medical attention. Basically, they require is a little bit of attention and also quarantine. So this facility is being provided here by the government, and then also good quality food. The Director of Health has given this one of the kind of food that we are supposed to give, and accordingly we are providing food. So it's a large facility with marshals, with different type of people for managing waste. Solid waste also is considered to be, now biomedical waste it is considered because of the infection that it carries. So that has a different protocol. So this is the first time such a thing, the country, the world probably is facing. So this is a challenging for the administration also, challenging task that we are facing, and we are learning experience. This is the 10th facility which is going to be started now.
The 10th in Bengaluru city, and the biggest.
The biggest, yes. So Bengaluru already has 9 centers in different places, ranging from 200 to about 500 beds, and they're going full. So, and then this place will provide a lot of relief to patients who are asymptomatic, and then the hospitals which are occupying, those patients can come here, and the hospitals,
the ones who are not so serious can actually come. So it will reduce the burden on hospitals.
The hospitals, and then people who really require a bed in the hospital can be, provided bed with the hospital. So this is what is the basic idea.
And this is all free, is it, for the patients who come?
By the government, yes.
It's all government.
All government of Karnataka, yes, ma'am.
Okay. Now, what is the status of admissions as of now? People will start coming in from...
So we already are ready for receiving patients, and then already our control room is reporting about 100 vacancies in the other city beds. Once that is filled up, and then we start getting patients here, ma'am.
You will start getting patients
here? We are all set with our doctors, nurses, everybody is here, you can see. There are more than 500 people working here around the clock, doctors, nurses, paramedical staff, marshals. And then solid waste management, cleaning, huge task. Yes, huge task.
Now, the capacity is of course 10,000 beds, but that won't all happen at once, of course. What will you be starting with? What are the numbers at the start?
Ma'am, we are open. we are ready for receiving about 5,000 patients. So this has got about 6,500 beds capacity now, right now. So 1,500 will be the other staff, which we are going to have. And then this doctors and patients, about 5,000 of them. So maybe in a week's time, this facility will become full.
It will become full. I mean, we can just see this is all for the staff, right? The people who are actually staying here.
For the staff.
Yes.
So similar facilities has been created. It's a lot of
that is a big question, of course. Are there enough doctors? Are there enough nurses for this huge facility?
Yes, ma'am. So basically, the protocol we follow here is for 100 patients, it's going to be 1 doctor, 2 nurses in 3 shifts. So we have for that many patients now, based on the number of patients which we have here. So many doctors and nurses will be provided here.
That definitely there are enough. There are enough as of now for the initial amount.
Yes. The government has taken a lot of efforts in bringing doctors, nurses, so there's no problem.
Another big question, of course, the facilities. We think about oxygen, ICU. Will the patients here actually require all that, or what about the need for oxygen and ICU facilities?
Ma'am, actually, oxygen here we don't require oxygen for the patients here. But our Honorable Deputy CM was a little concerned. He said that in case if some oxygen is provided here, don't need to shift the patient to the hospital, they can be treated here. So we'll look in the future if need be. It's not a big facility to be created. It can be done in a couple of hours. It can be done.
Absolutely.
Yes.
Okay. And you mentioned security as well. It's not just doctors and nurses and health staff. What kind of security is being provided here?
Ma'am, now a lot of, ladies are here, women are here. And then the BBMP marshals, they are ex-servicemen. So they are going to be here to take care of their internal security, so that nobody misbehaves with anybody. A discipline is followed
because
here.
We have heard some disturbing stories.
Stories in the places. And also they also monitor the food being distributed to check if the places are clean, because they keep reporting. We also have CCTVs where we have a dedicated control room which monitors the whole thing. Because now if you see, all our officers will be watching on live as to how the patients are faring, how they've been looked after.
So they can look remotely. They can remotely monitor what is going on.
So the marshals be watching 24/7, and officers also been posted. Half a dozen Karnataka Administrative Service officers are posted here. Probationary officers are working here. They are also reporting in the matters. Each of them are given one hall in charge. So every small bit has been reported here.
Okay. And these are patients coming here after the COVID care centers in the city are full? How does it work?
It's now, ma'am, we are open to anybody coming in here. Like for example, somebody who's got a COVID positive report with him.
Yes.
And people between the age of 14, 15 to about 60 years, up to 60 years, we provide them accommodation here. So they can come here and stay.
They can come by themselves also. If they're well enough, they can drive up and just...
Yes, we have doctors here. They will do an initial screening and then
So they can come through ambulances, they can come in their own private transport.
Yes.
They can come here as long as they're directed to a COVID care center.
Yes. So that like I said, the panic situation in the city.
Yes.
There's a lot of unnecessary panic which is happening in the city, stating that the beds are not available. So once this is started, our honorable CM was very particular that citizens should not panic. There's no need to panic. So this is if you see in all the COVID care centers, about 98 to 99% of the patients are going back home happily. They're going. That's a good thing, So I would like to reiterate here that people should go back happily. That is what was our honorable Chief Minister very particular that people who come here should go back happily from here, and they should also send a message.
There are recreation centers, dining hall.
Recreation dining hall. Very good food we are providing, and some of the patients said that we would like to stay for 3-4 days more. Yeah.
And of course, you are starting with a few hundred, not the full 10,000 starting immediately. This is really one of those places where you hope that all the facilities will not be used, that all 10,000 beds will not be busy at the same time.
Ma'am, I see, looking at the cases, the spikes that we are seeing, maybe it may not be full. At least, we have a facility which has got some 20-30% buffer. So anybody requires emergency. Like for example, the other day there were some prisoners. They had to be brought in with the guards. So those kind of people come, like the 70-80 people had to be brought in immediately.
Okay, so prisoners along with their security.
Security, we had to bring them. Or something in some area there's a containment zone, and then you find suddenly a group of people who are
a large number which has to come in at the same time.
Exactly. So this facility will be available.
Very useful for that.
Very useful. Okay. And then maybe in course of time, when this, because this is one centralized facility, if it runs, then the smaller facilities which don't really need to be looked into can be closed. Instead of creating too many facilities, or one facility can provide everything here. Like for example, ambulances, doctors, marshals, everything is here. It's a huge hospital that we have created here.
And there was of course an issue, I think, initially about renting or buying of equipment. Now everything has been bought. Has it?
So 7 of the equipments, like what you're saying is the government said that the beds, the cots could be reused actually. Especially the cots and the tables, the chairs, we don't need to hard furniture like the fans. This could be so. The government decided to buy it. So 7 of the items have been bought.
That's also a saving rather than renting for each of these.
So the other things which had to be rented, for example, these are things and all cannot be used. So this had to be rented. So we have rented this. So these are some of the things. This
is really a huge convention center, a real big exhibition center here, spread over 50 acres, being repurposed. A sign of the new times we're living in, I think. Really.
Yes, ma'am. So this, and we're lucky that we have this place, and especially I would like to thank the BIC people who have been extremely cooperative with us in providing this facility, and they have given all the facility to us. We have CCTV cameras, we have public announcement system. We can talk to anybody from anywhere from the control room, and we can address them. And we also plan to have yoga for people who are staying here in the mornings, so keep them happy.
Thank you very much.
Thank you, ma'am.
Sarfaraz Khan, Joint Commissioner of the BBMP, explaining to us what is going to go on here at this 10,000-bed COVID care centre on the outskirts of Bengaluru, a huge convention centre which has been converted into a centre to care for asymptomatic positive patients. With DM Kumar, Maya Sharma in Bengaluru for NDTV.